Okay, next on our list of gram-positive rods is Corynebacterium. And this is going to be the last one of what we would call the typical gram-positive rods that are non-branching or not acid-fast. Now, believe it or not, we vaccinate in the U.S. for Corynebacterium. That doesn't stop them from asking it very frequently on the USMLE. So we're also going to consider Corynebacterium high yield for the step 1 of the USMLE. Okay? These are gram-positive rods. Again, they don't form spores because remember that's unique for Bacillus and Clostridium. And while we're going to be talking about Corynebacterium diphtheriae, I want you to realize that we have a lot of normal flora that are Corynebacterium species in the respiratory tract. Okay? We refer to them as diphtheroids, which basically means a non-pathogenic Corynebacterium. Now, that's going to become important for diagnosis, all right? So hold on to that fact, and we'll come back to it in a little bit. Now, what are the distinguishing features for Corynebacterium diphtheriae? This is the one you'll see in board review books, and the buzzword here is Chinese letter formation. So they'll sometimes say that when you gram stain Corynebacterium, the rods kind of get together and they will look like various Chinese letters. Or here they're just talking about the V or L shapes. Now, one of the media that you can grow Corynebacterium on is called tellurite medium, in which Corynebacterium will have these grayish, blackish colonies, all right? Probably not a super high yield media, as for example McConkey or chocolate agar, but just another little tidbit of information for you, okay? Now, on another type of media, you will see granules produced, all right? And they will stain metachromatically. That's another distinguishing feature for Corynebacterium diphtheriae. Probably something they're not going to mention. Probably what they look like on gram stain is going to be a little bit more important. Now, in addition to some of the features we talked about, we know that diphtheria is one of those toxigenic organisms. And the toxin works by how? Inhibiting protein synthesis. All right, and we'll talk about the mechanism in just a minute. Just like we talked about for botulism, okay, toxigenic Corynebacterium diphtheriae have a prophage, which means they acquired the toxin basically from transduction, all right, that we're going to talk about in Chapter 3. So, again, keep that in mind. How, the exam's moving towards a more clinically based exam. So it's not like they're just going to ask you flat-out questions about a lot of the genetic manipulations that can happen in bacteria. So they're going to try to make it clinically relevant. How will they do that? They'll give you a case of diphtheria and ask you how the organism acquired that toxin. All right? Now, what's the reservoir? The throat and nasopharynx, basically. Therefore, we're talking about transmission by way of respiratory droplets. Now, what's important to realize about diphtheria is that it's not an invasive infection, despite the fact that it has effects basically in the oropharynx or the respiratory tract. It goes, we know, to the heart, it goes to the nerves, but it is not systemic infection, all right? It's not invasive. What happens is you get colonization, okay, by Corynebacterium, and the organism will start making the toxin. And it's the toxin that goes systemic, all right? The organism stays right where it's comfortable. In the respiratory tract, it starts making the toxin, and the toxin goes systemic. So once the toxin gets into the circulation, it then has its effects typically on the heart and then typically on the nerves. All right, so that's an important fact to remember. Now, how does the toxin work? This is one that acts very similar to Pseudomonas aeruginosa, and these interfere with elongation of the protein. Okay, but the overall thing you really want to remember is that it inhibits protein synthesis. So we're going to start getting some cell death. Now, because of the way the toxin works, once the organism colonizes the oropharynx, you're going to start to destroy some of the cells and the tissue in there. And one of the buzzwords for, at least the starting point for diphtheria, is that you'll sometimes see this dirty gray pseudomembrane, okay? And that dirty gray pseudomembrane is basically necrotic tissue in there from the toxin. And one of the things they like to mention perhaps in a vignette about that pseudomembrane is sometimes you'll go in and you'll try to scrape that a little bit and it bleeds very easily, as opposed to if you had a pus pocket back there or if you had a little bit of yeast back there. All right, so this bleeds very easily. Now, what we worry about with that pseudomembrane is if it gets really large, it can extend into the larynx and trachea and you can get obstruction. All right, but now once the organism starts making that toxin again, it gets into the circulation, then we have effects on the heart and potential nerve damage. So what I want to show you first is this kind of dirty gray pseudomembrane that you can see in the back here. Again, if we were to go in and scrape that pseudomembrane, it would probably bleed very easily. The other thing you'll see a lot with diphtheria is what's called a bull neck. So the neck is extremely swollen, okay? And once the toxin gets into the system, we start to see myocarditis, nerve palsies, for example, and that's the effect of the toxin actually once it goes systemic. Now, diagnosis. I told you I wanted you to remember that Corynebacterium diphtheriae is a toxigenic Corynebacterium, but we have many normal flora organisms that are Corynebacterium. Okay? So when we try to diagnose this, we have to differentiate your normal flora diphtheroids from toxigenic Corynebacterium diphtheriae. And the test that's used for that is called the ELEC test. Now, I'm going to describe the ELEC test on the slide. So you have an agarose dish and you have a strip of filter paper that has been soaked in antitoxin, all right, diphtheria antitoxin. And what you're going to do is you're going to isolate the suspected organism from the patient, and you're going to streak the isolate across that filter paper. So if you're following the pointer, we're streaking it across, and we're streaking it across here, etc., etc. Okay? Now, toxigenic strains will form an arc of precipitation with the antitoxin. So you'll get these precipitation arcs. So for example, this top strain would be positive for Corynebacterium diphtheriae. All right? The middle two strains would be Corynebacterium, but they're normal flora. You can see that there's no precipitation arc, which means that they're non-pathogenic strains of diphtheria. Now we look at the bottom, and again we see these precipitation arcs, and those precipitation lines mean that the bottom strain is also a toxigenic strain. Okay? Additionally, you could do PCR to detect the toxin gene, but again, a lot of the times they're not going to tell you about those molecular tests because then they would have to tell you what it is. And they're just not that nice, are they? No way. All right, treatment for diphtheria, again, we've talked about this a few times, is that we have an antibiotic and now we have a toxigenic organism for which we do have an antitoxin. So not only are we going to give erythromycin, but we also have to give an antitoxin to neutralize the toxin. Okay? Now, if it goes systemic, as far as the toxin goes, and you can get endocarditis, you're actually going to have to up the intensity of that antibiotic therapy and give IV drugs, IV penicillin and aminoglycosides. Now, as far as prevention, it's part of the DTP vaccine. We mentioned the T, so that was tetanus. This is the D. It is also a toxoid type of vaccine. So it's an inactivated toxoid vaccine that we give routine boosters of. Okay? So that's the prevention for Corynebacterium diphtheriae.